Healthcareonomics, changing healthcare by changing the way you think about healthcare. Hi, everybody, and welcome to this week's Healthcareonomics for Employers. My special guest again is Tom DiLiegro with Benefit Advisors of Charleston, South Carolina. I'm Dr. Kevin Wacasey, the host of Healthcareonomics, and we'd like to welcome you to the show. Tom, thanks for joining me again today. I really appreciate it.
It's a pleasure to be back with you. It's always something I look forward to.
All right, great. Well, so let's talk about, Tom and I had discussed what we were going to talk about this week, and I figured that since he is a benefits advisor and since he specializes in working with companies and employers on this, like I said, madness of health insurance and healthcare coverage these days, I thought I would ask Tom to share some really hilarious stories. I'm an ex-emergency physician. I used to work in the ER. So one of these days we'll get into some of my hilarious stories about things put in body cavities that shouldn't belong for $400, Alex. But I thought we would talk a little bit about the employer's perspective and some really silly and stupid things that Tom has witnessed throughout his career. So, Tom, take it away.
Yeah, I appreciate it. And I continue to be baffled by the concept of coverage. It seems people want things covered for the sake of having them covered. And it's funny, there seems to be a new hotshot thyroid or endocrinologist physician here in town just opened up shop. And they are doing a great job marketing and talking about how our thyroid can wreak havoc on and I apologize for whoever might be listening to this, but a middle-aged woman's body. Say between 30 and 50, although I think 30 might be a little young for middle age. So we have these women flocking to, I don't know her name, but anyway, and a lot of the diagnoses have come back, and a lot of people are finding out they have Hashimoto's syndrome.
Okay.
And so
that's a condition where the thyroid gland gets attacked. It's an autoimmune type process, correct. And so your thyroid gland stops producing enough thyroid hormone, and you become hypothyroidism, which is too little thyroid hormone floating around. Very, very common condition, actually.
Right. So suffice to say, the scripts for things like Armour are increasing, right? And Armour in and of itself is
there's an endocrinologist who's prescribing Armour Thyroid? That's
yes.
Interesting. Okay, that's interesting.
What's the synthetic Synthroid?
Yeah.
Right? Is that So being an all-natural alternative, they're prescribing Armour. And I saw a description of the benefits for this prescription when one of my clients' employees went to fill it. Now, keep in mind, this individual was a 39-year-old female. The cost for her under her Blue Cross Blue Shield Major Medical, it's a high deductible. Yeah. The cost that's being split between the employer and herself is $412 a month.
For the Armour Thyroid?
For the total monthly premium.
Oh, for health insurance. Okay.
Right. What did that get her? That got her something she's very, very proud of, a $12 discount off of that Armour Thyroid medication. So I just sit back and I look at it and say, for the sake of having it covered, at $412 a month, you got a $30 drug for $18.
No, okay, so hold on a second. Let me clarify something here. The generic thyroid medicine, the synthetic thyroid medicine, it's called levothyroxine, of virtually all strengths can be purchased for $4 a month at, like we said last time, Walmart and Kroger and perhaps some other pharmacies around the country. Or you can get a 3-month supply of this thyroid medicine for $10. So my patients that I have on this medicine that I take care of, I literally tell them your thyroid medicine is going to cost you $40 a year. That's $10 every 3 months. So the Armour Thyroid, just to clarify for the audience, Armour Thyroid is the oldest thyroid medicine around. It's been around for, over 100 years or so now, because what it literally is, and the reason it's named Armour, is because it comes from pig thyroid glands. This is nothing more than dried out pig thyroid glands that are ground up and pulverized. They're turned into powder, then repacked into pills, and then sold to the public as Armour Thyroid. So this stuff ought to be dirt cheap, like cheaper than bacon even. But you're telling me that it's how much a month for the Armour Thyroid?
$30 as an all-natural alternative to levothyroxine.
$30. Okay, so let me get this straight. $30, that's $360 a year versus $40 a year for the synthetic version. Now, okay, I understand if somebody wants to take all natural, if they want to be organic or what have you, I get it. But so you're telling me that somebody you know, one of your clients, has an employee who is spending how much a month on the insurance?
So the discount is $12.
No. How much is she spending a month on health insurance?
$412.
And is that how much she's spending, or is that how much her and her employer are spending?
Split. That's the employer's liability. That's what the employer is spending a month, and that's the only thing she takes. Now, we understand that the insurance piece, the risk, is built in.
Yeah.
But it leads you to question, good grief, why are we covering things like Armour when it could be $30, despite the fact that it's more expensive than levothyroxine?
Yeah. So let me get this straight. Again, I want to figure out these numbers. So how much is this insurance premium total? The employer is paying $412?
Yes, exactly.
How much is she paying?
She's paying $12. The employer's paying $400 a month. That's the employer's what's called defined contribution.
Now, can I ask you?
We're going to give you $400 a month. You pay anything above it. So that's how that works.
So let me ask you this. Is this the gold plan that she's on, or is this more of
It is not, actually. This is the bronze plan, which is even scarier because the bronze plan is that expensive.
Yeah.
And that's just what the market is for an employer who is not willing to dip into, some of the more innovative solutions that are available to an employer.
Yeah, the non-health insurance solutions.
Correct.
And this is not a self-insured employer, I would imagine.
Not.
This is what we call fully insured employer, where they pay the health insurance agency to basically take on all their risk. Correct. Wow. So let me get this straight then. So $412 a month, and this woman is probably relatively healthy. She's young, I would imagine. And her only claim to fame, her big savings on that is, again, how much? $12 a month off of her medication? Correct. Okay. So we have here, folks, a situation where, again, a lot of news is out there about why are these medicines so expensive, and why do medications cost so much, and PBMs, et cetera. I would wager that if health insurance didn't cover Armour Thyroid to begin with, then it wouldn't be that expensive. It would probably be much closer to the $4 or $10 every 3 months that we see with the synthetic levothyroxine.
I would suspect you being right there. And listen, this is my client, and I said, listen, just pay for it. Well, why would I just pay for it when I can get it for $18? And
Yeah, because every time that let me think this through here. Every time that this woman gets this medicine through her health insurance agency, she is filing a claim on the health insurance.
And the health insurance sitting there going, ooh, we have a thyroid condition now, don't we?
Right.
Let me check that on the box as we evaluate your group next year when it comes to reevaluating your annual premium increase. In car insurance terms, that would be what's called a risky driver. Yes,
somebody who files a claim every month on their car insurance. In fact, they'd probably kick her off the car insurance if that were the case. Wow.
Likely. Yeah.
Wow. Well, I'm sure that's not one of your worst stories, but it's still pretty interesting to find that people, and again, it's just this whole idea that I pay so much for my health insurance, I have to take advantage of it. I have to squeeze every single drop out of it that I can of potential value, because if not, then I'm getting ripped off. And never mind.
It's the health insurer's own creation. I mean, with the rising costs, the employee's logical reaction is, well, I'm going to get you back, Mr. Health Insurance.
That's right.
And I'm going to use this darn thing. Not realizing that Mr. Health Insurer is looking at it going, I'm going to show you next year. And it's the perpetual raising of the risk, raising of the premiums, raising of the costs.
So what does the employer have to say about all this? If you were the employer of this person, what would you say to her? Or can you say anything that's going to make a difference?
Can't say anything. So the employer really can't know and shouldn't know who is taking, who has the Armour, who is taking Armour, who has a thyroid condition. And it's the easy button. So a lot of employers say, listen, I'm providing a benefit. Check the box. My budget is $400 per employee. Anything above that is on you. So when you have a set amount like that, it's hard to get people to take action.
Yeah.
Because they're able to say when recruiting employees, hey, we offer health insurance. And really, that's all people are looking for. Do you offer health insurance?
Now, you're telling me that it's illegal for the employers to know what's going on?
It's a HIPAA violation if they were to know what their employees' health conditions might be.
I think I just discovered a whole new reason why HIPAA was passed in the first place, eh?
Possibly.
Wow. Well, I thought that we would talk about some other dumb things these days that employers and employees are doing as part of this whole health insurance business, healthcare coverage business with employees. So I wanted to talk about one example I'm familiar with. And that's this really happened. A patient of mine came to me a few years ago when she joined my practice, and she happens to be in the healthcare field, but her husband is a firefighter for a local city here around the Dallas-Fort Worth area. And she was asking me, the reason she had come to see me was because she had attended a health fair that was given by this fire department, by the city, I suppose, and the fire department hosted it. And at this health fair, she had been sniffed by a dog.
Sniffed?
Yeah.
The
the city had paid this company, apparently it's called Cancer Dogs, to come out and, you know where this is going, and literally smell people, sniff people to try to detect cancer. Now, I have no idea what, if Scruffy raises his right hind leg and scratches, or if he, sits down and moans. I have no idea what the trigger would be or what the sign was. She couldn't tell me either. She said it was a very non-specific test. The dog was just sniffing all these people. And wouldn't you know it, a lot of people, like herself included, a lot of people got the positive whiff test from these dogs. And, oh, by the way, this company had a $150 blood test waiting right there on hand to check this out and to screen for various tumors. And I asked her, I said, what kind of cancer were they looking for? Because cancer is not a single disease. I mean, cancer comes in all different shapes and sizes and flavors and varieties. It's more of a DNA, a mutational disorder than a single disease. She couldn't tell me. She said that they had this blood test that was very nebulous, and that she took the blood test and it showed up positive. So then they wanted to send off some $600 or $700 confirmatory test to see what was going on. And at that point, this dog smelled a scam. And I was just amazed by this. And, of course, this poor lady was freaked out beyond all measure. And after I talked with her and went over her history and everything, I assured her that the likelihood of her having cancer, given what she had done to take steps, getting mammograms and pap smears and doing breast self-exams on herself, she was very diligent about that stuff. I said, look, I think the risk of you having cancer is very low. I don't know what the dog thought he or she smelled, but I don't smell anything. So, and here she is 3 years later, she's doing fine. But it really struck me as to the level of desperation that employers are getting to shave off their healthcare costs for their employees and to help keep their employees happy in this environment whereby the health insurance thing is doing a negative seesaw. That's not a great analogy, but it's doing this thing where you're getting less for more. Mm-hmm. You're paying much more money for premiums, and then you're getting a lot less in deductibles, coverage, and things like that. You're having to pay for a lot more stuff, like your Armour Thyroid medicine. So to me these days, it seems that employers are doing some really stupid things and shooting themselves in the foot. I hope I don't offend anybody with that, but they're really doing some things that are shooting themselves in the foot and really making it so that the health insurance companies are laughing all the way to the bank.
Well, the sharks are coming out as well. As in your example, people see, there's a high cost plan. that also has high costs passed on to the employees.
Right.
So what do we need to do? We need to put in preventive measures. Well, those preventive measures, as you outlined, are extremely expensive in and of themselves. Who even knows if they're even necessary? But people are so worried about having to incur those high deductibles and high out-of-pocket costs that oftentimes they are sold a bill of goods for fear of having to actually pay that $6,000 or $7,000 deductible. So it just invites in more opportunity for some shysters and for people to see opportunity to exploit on behalf of some desperate employees and employers.
Yeah, and I'm telling you right now, I did some research on this whole idea of cancer dogs, and it's an interesting concept. There is some scientific research going on to study it. So far, it's come up with a negative shake of the tail. Not much is showing that it's actually legitimate or even useful. In fact, I read one study where they tried to train 4 dogs. They had somebody who literally had cancer. They had this person urinate in a cup, and out of 4 dogs, only one could really consistently detect, or at least show signs that maybe they were scratching behind their right ear. I have no idea, but
I'm sorry. I don't see it. As somebody who went to medical school for 4 years in residency, and a dog.
Well, the argument is that dogs have noses that are something like 100,000 times more sensitive than ours, which is a good thing because, man, if I had a nose like that, I'd never get anything else done. I'd be smelling everything. But you have an example. We mentioned this. Pardon me. The allergies are coming out early here in Texas. We've had some spring-like weather lately. And we mentioned this last time about biometric screening. So I want to dive deep into that because that's a whole nother avenue where you and I have talked about this, and it's pretty obvious what's going down. And everybody knows it, except, I think, for employers and employees. They have no idea what's being done to them. Mm-hmm. So let's talk about that a little bit.
Sure. It feels good, first of all. We care about you, Mr. Employee. We're going to try to do some preventive measures to make sure that you're healthy, and we're going to incentivize you by giving some sort of financial discount on either health insurance, lowering of out-of-pocket expenses, and a lot of times the insurance companies are doing this as a sales tactic to try to get people on board with their product.
Right.
You and I both know there are no free lunches. You're paying for it one way or the other.
So explain that. Explain what they're doing. So let me clarify for the audience. A biometric screening is where you have somebody come in, you have employees line up. It's kind of a health fair setting, I would say. And the employees are screened. They have their blood drawn, and they measure a blood sugar level, which a one-time blood sugar level is useless in picking up diabetes, especially given the fact that I would bet that a significant percentage of these people forget that they're supposed to fast overnight the night before.
Yep.
So they probably hit the jelly donuts before the blood gets drawn. They hit the jelly donuts at 7:30. The blood gets drawn at 8:30. Their blood sugar is through the roof. And who does that help? We'll get to that in a moment. But then the other thing is they do a lipid panel. They do a cholesterol screening. And again, I would submit that a lot of people have cholesterol values that are out of whack in this country. That's just a given. And do all of them need treatment? Not necessarily, but it makes for great actuarial data when you're coming up on your health insurance renewal. But then the other part of the biometric screening is even more nefarious, I will say, evil even. And that is where they do a height and a weight, and they calculate your BMI. Mm-hmm. Now, that in and of itself the BMI is a great measurement as far as if you are obese, if you have a weight to lose, then the BMI is your friend. But BMI is not great in everybody. Like for myself, I'm 5'7", I weigh 185 pounds. I have a lot of muscle mass on me. I am, by technical standards, by the BMI, I'm not obese, but I'm almost obese by my BMI. My BMI is about 27.5, which puts me in the overweight category. I'm not overweight. I just weigh a lot for my height. So BMI is not a great statistic to look at blindly. You have to take it into context. But then the best thing that they do, they also measure a waist circumference, which a lot of people's waists are a lot more than they ought to be. So that's great data for the health insurers. But then perhaps the worst one they do is a one-time blood pressure measurement. Now, doing a one-time blood pressure measurement is about as useful as visiting Texas last week when it was like April here. And you decide that Texas is a really nice place to live. And it is. Don't get me wrong. I love Texas. I'll be here the rest of my life. But you move down here in August, and you find that it's really hot in Texas. Yeah, it's a little hot under the collar. So if you go based upon some very limited information, some one-time data, you can get a very skewed and wrong picture of what's really going on with someone. In fact, the American Heart Association doesn't even recommend that we make the diagnosis of high blood pressure without three separate readings, separated by at least a week or 2 weeks apart each. And yet these health insurance companies are going along and doing these one-time blood pressure readings on these employees. And guess what they're finding? That probably around, 90% of these folks have high blood pressure readings, right before they get a big needle shoved into their arm. Well, are you surprised at all? I'm not. And so these biometric screenings are done in the guise of, as you say, helping people out for feel-good measures. Oh, we'll give you a discount on your health insurance premium next year for participating. But the reality is, what do you think they're using that data for, Tom?
They're using it to rate the group to get information that they normally wouldn't be able to get.
That's right. And this is a case where I think HIPAA protects the medical information from everybody except those who shouldn't have access to the health information of people, namely the health insurance companies.
Right. And I think the people who have some health issues, I think they already know it without getting stuck in the arm at their employer.
Right.
And the people who are much more likely to comply and hit those incentives typically are the healthier employees. So you're inadvertently adversely affecting your unhealthiest people, who the primary goal of these wellness screenings is to help those people, and it's totally backfiring and having the opposite effect.
And think of what it's doing to the health insurance premium. I mean, I love that, because actuarially, how health insurance companies design and define their premiums for the next coming year is based upon what happens this year, correct?
Correct. It's a lagging indicator.
Okay, and so if you file a bunch of claims, like for Armour Thyroid, if you file 12 claims a year, or however many that person files a year for this medicine that ought to be just purchased right out of pocket, the health insurance company adds all these claims up and says, okay, this group represents this much risk, and we're going to base our premiums based on this. So tell me if I'm wrong in supposing this, because I think I wrote about this in my first book. And that is that these biometric screenings are often given out with the promise that your health insurance premium, we're gonna knock $20 off your health insurance premium per pay period. Or what do they take off typically? Do you have any?
It varies. A lot of them will give a deductible reduction. So, for example, your deductible will go from $1,500 to $1,000. Okay. And I think you and I both know that the deductible is the most meaningless number.
That's right. It's a marketing
out there
gimmick.
Today, because the number that matters is the out-of-pocket maximum, which in cases today, a lot of them go up to that federally allowed maximum of $7,900. So
per person.
Great, correct. And so you lowered my deductible from $1,500 to $1,000, but if I break my leg and have a compound fracture of the femur, I'm still out $7,900 despite all the poking and prodding and blood taking, and that deductible lowering doesn't really do much for that employee.
So tell us, let's get to the out-of-pocket maximum. $7,900 is for an individual. Tell us what a family is.
In 2019, the federal government says no individual can have an out-of-pocket maximum more than $7,900, and for a family, that's times 2.
So that's what, $15,800.
Correct.
So what I like to say is, if you have a $15,800 out-of-pocket maximum, then your $1,500 deductible is stupid.
Meaningless. Yes.
Any questions?
Yes. Right.
So you're telling me they dangle this shiny object in front of these poor employees, and they make them think that they're getting something in exchange for this data.
Correct.
So give us a range on how much you've seen them lower the premiums by. So $20 a pay
varies. I
period, 40,
mean,
60, 80?
it can be as little as 20 to as high as 100. Some of them and some of the package solutions are getting more aggressive.
Yeah.
So, for example, I saw one yesterday where, if you followed their, best practices or went to their center of excellence, they'll waive the deductible in out of pocket completely, and the employer will pay for it totally. To me, that's a great benefit, but that's an anomaly. That's not the norm.
Wow.
The norm is to have a marginal decrease on your per pay period contribution to the premium, or have some offset or lowering of, say, the deductible amount, or maybe a copay being waived here or there.
Right. So doing a biometric screening, let's just bring this around full circle. So doing a biometric screening and then reporting that data to your health insurance company, that would be similar, correct me if I'm wrong, but wouldn't that be similar to letting a robber inside your house, giving them the keys and the alarm code and maybe a milk bone for Scruffy or something to calm him down while they're robbing your place?
Well, I wouldn't classify health insurance as depending on who we're talking about.
Yeah.
But you're not far off. It is a lot like the fox guard in the hen house for sure.
Well, how about this? How about you're giving them all the goodies that they need to raise your premiums the next year? You're absolutely handing them this data that's packaged into this beautiful little, just, here you go. It's a nice little package for you.
And I would contend we're doing it and this is off subject totally, but if you guys look at the what's going on in the life insurance market, they're mining your own personal data from social media. So if you happen to be taking a photo of yourself, MHOC, monster hit only from a big giant bong, or if you happen to be smoking on your Instagram profile and you say you're a non-smoker in your life insurance application, life insurers are using that to rate you if you happen to be applying for life insurance on your own. So I think this is an overall trend from insurance companies in general.
Yeah.
The health
Gathering
insurers
information.
You're not exactly. The health insurers are certainly not limiting themselves from being lumped into that data collecting.
So if you're a smoker and you say, I'm not a smoker, but they catch you puffing up on Facebook or something, they can rate you and say, not only is he a smoker, but he's a liar too. So
yes.
Is there a rating for lying?
Is
that a risk category?
There's a term for it that I'm blanking on right now. But yeah, there is.
Wait till they catch you in that picture jumping off that cliff with a what is it, a wingsuit attached to your back. And the airplane's flying off there in the distance. You're going to land in the airplane. Boy, I don't know how those people get life insurance, period.
Right.
Anyway, they don't need health insurance. They need good life insurance.
Exactly.
Because if you fall from that distance, you're toast.
Data is a fascinating subject. We could spend all day talking about data. And I look at it and it's like, guys, we're giving it to them already. You can't be mad if they rate you because you're willingly participating in these wellness screens. You're, posting whatever you might be posting online to be used against you whenever you need a financial instrument to protect your family. So it's just something we all need to be more cognizant about.
Yeah, and it's sort of like the Facebook and the Twitters and all these other social media platforms, which I love, by the way. I like Twitter. I'm not a big fan of Facebook anymore, but I think that we are the product. We're not the consumer. We're the product. And so when it comes to these biometric screenings, just want to be clear on this, employers. If you're doing these biometric screenings and you're having your health insurance company involved, then you are literally handing them the information that they need to work against you. You may get $20 off a pay period this go around this year. They may lower it by $40 a pay period. They may give you $500 off each employee's deductible. But they're going to use that information. I challenge any employer out there to comment in the link below as to why or any given year that their health insurance premiums have decreased, especially after the implementation of these biometric screenings. No, I would submit that they are just going through the roof, and the biometric screening data is being used against employers to help that process along.
And not only that, employers are being charged an arm and a leg to have these entities come out and conduct these wellness screenings.
Wow.
And by their own estimation, the wellness industry, even estimates that there's an actual negative ROI for their product. And there's a fun little bet going on by a company called Quizify. If you can show a positive ROI, so any employer who has a positive ROI, according to certain criteria, Al Lewis will give you a $3 million reward if you can show a positive correlation in terms of your investment to what you get out of it for any sort of wellness screening or wellness program.
Well, I will say, full disclosure, I have a little entity that I conduct local around the Dallas-Fort Worth area health fairs. I call them health events for employers, and we do screenings and much more than just a biometric screening. But I have to say that we don't report that stuff to the insurance companies. Now, they can go find it if they want to, because anytime you have a lab done, if your name is Mortimer Snurd, you're a pretty unique guy, or Tom DiLiegro or Kevin Wacasey, they'll probably be able to find my data if they really want to go look for it. But there's a difference in the insurance companies having to go find that data on an individual basis versus having the entire workforce present them with a bundle of data that is unique to that workforce, that is comprised of that workforce, and that's used to rate that workforce.
Yeah, I think it's a key distinction.
Yeah.
I don't think either of us are saying that they're not valuable exercises or valuable experiences.
Oh, yeah.
To have your employees go through. I know several who have, some people have identified a certain cancer or a certain health condition.
Oh, yeah. Not with cancer dogs, though. Not with cancer dogs.
Not with cancer dogs.
Yeah.
And leave your health insurer out of it, right? If you want to do that for your employee, do it as a true benefit, as a benevolent employer.
Yeah.
Don't have it coordinated by the health insurance company or turn that data over to them.
And my beef with the whole biometric screening thing, also from a healthcare perspective, not a health insurance perspective, is that much like the cancer dogs thing, I don't think it goes far enough. If you're only collecting these little bitty points of data that you know are going to be out of whack in most people, you're not really doing people a service. I mean, I have found so many things. I've found a case of leukemia. We do ultrasound studies. We found several. I could tell you stories about that. But that's about all the time we have this week. I thank you again so much, Tom. Tom is with Benefit Advisors of Charleston. You can find the link to his company below. If you're in the South Carolina or the Eastern Seaboard area or anywhere across the country and you think that Tom can help your business out, please give him a shout. Check out what he's doing, because he's doing some pretty innovative things with health insurance and healthcare coverage these days for employers. So, Tom, again, I want to thank you for coming on the show. Next week or next time, I think we'll talk about the legality of sharing employer and employee information and how health insurers have really got that sewn up. You piqued my interest talking earlier about that.
Sounds like a plan. Sure.
So let's make that a topic.
All
right, Tom, thanks again. We'll see you next time. Everybody, stay safe. Now you can easily compare health insurance plans and pick the one that makes the most financial sense with the Dr. W's Equation app, available for Android and iPhone. And for more information on how you can save on health insurance and healthcare, check out my books, available now on Amazon, iTunes, and Nook. To help spread this message, please click the like button on this video. You can also subscribe to the Healthcareonomics YouTube channel and visit healthcareonomics.com.